The patient portal was originally designed for convenience. Patients could check their test results or request medication refills without calling the front desk. But over the last decade, that simple feature has quietly become the heaviest administrative load in outpatient medicine. This chart shows the national rate of patient portal usage over a 10-year period. In 2014, only a quarter of patients logged in to view their medical records. By 2024, that number climbed to 65%. The sheer frequency of logins has intensified right alongside those total numbers. The percentage of frequent users, patients logging in 6 or more times a year, more than doubled, jumping from 15% in 2019 to 34% in 2024. Then there is a hidden layer of activity compounding the overall volume. Caregivers managing accounts for elderly parents or children now generate significant digital traffic, with proxy access rates doubling to 51% over just 4 years. The system built for basic convenience is now carrying the weight of a massive, unmanaged intake channel. Traditional clinical workflows were simply never designed to absorb this level of constant digital demand. All of that incoming volume lands directly in the physician's electronic health record inbox. Primary care doctors are now forced to process between 33 and 49 electronic messages every single day of the week. This pie chart breaks down a primary care physician's total time spent in the electronic health record. Managing the inbox alone consumes a full 20% of their total EHR time. That equates to about 7.8 minutes of invisible administrative tasks extracted for every single patient visit. For a doctor seeing 20 or more patients a day, that workload spills over into what researchers call pajama time, hours spent catching up on documentation at home. The average physician workweek now sits at nearly 58 hours, with 13 hours dedicated to indirect care, like managing referrals and interpreting test results. This continuous after-hours labor is strongly linked to clinical burnout. It creates what administrators call the inbox paradox. When a practice successfully engages its patients by encouraging telehealth or promoting digital follow-ups, they generate an enormous penalty of incoming administrative requests on the back end. By providing highly responsive, digitally connected care, practices are inadvertently penalizing their own physicians with an unsustainable load of unpaid after-hours labor. Attempting to offload this digital volume onto traditional front office staff quickly leads to operational bottlenecks. Receptionists are already juggling ringing phones and physical patient check-ins, making it nearly impossible for them to accurately process an ever-growing queue of portal requests. Placing that pressure on an in-house team accelerates an inescapable cycle of attrition. Medical practices are currently seeing a severe 40% annual turnover rate for front office support staff, while clinical support roles follow closely behind at 33%. Every time one of those employees leaves, the practice absorbs a severe operational and financial hit. Recruiting, training, and covering the lost productivity to replace a single medical assistant or front desk worker costs between $9,000 and $12,000. This compares typical office availability against actual patient activity. The narrow block represents standard 9 to 5 in-house staff coverage. The continuous scatter plot around it shows when patients actually send messages, late into evenings and throughout the weekend, creating a massive backlog every Monday morning. Trying to satisfy round-the-clock digital patient demands with a strict 9 to 5 in-house workforce is a structural mismatch guaranteed to fail. To break this cycle, high-performing practices are shifting to an outsourced, dedicated virtual medical assistant model. Instead of treating portal management as a side task, these practices isolate it. They deploy a structured, protocol-driven remote team whose sole responsibility is managing the inbox. Studies show this highly specialized approach drastically reduces the amount of time primary care physicians spend documenting in the EHR and completing work after hours. This workflow diagram illustrates how the system operates in practice. Before a human ever sees a request, integrated artificial intelligence, specifically natural language processing, automatically scans the raw incoming messages. The AI filters out the noise, flags redundant submissions, and organizes the critical data. Because sensitive patient data is leaving the physical office, this entire off-site operation relies on an enterprise-grade compliance framework, strictly adhering to HIPAA regulations and stringent international security standards. By seamlessly combining the speed of advanced AI automation with the careful judgment of a dedicated, specialized human team, practices transform a chaotic inbox into a predictable and highly secure operational pipeline. This bar chart compares the real financial impact of the two staffing approaches. The first column represents the fully loaded annual cost of maintaining a single in-house staff member. When you factor in base salary, benefits, payroll taxes, and overhead, that single position costs a practice approximately $60,800 a year. The second column shows the annual cost of an outsourced, dedicated virtual medical assistant working a standard 45-hour week. Because the physical overhead is completely removed, that lean, predictable cost drops to just $21,600 a year. This structural shift generates an immediate and scalable financial return. For every individual front desk or medical assistant role replaced by a virtual workflow, a practice realizes a 64% cost reduction, saving nearly $40,000 per year per position in pure operational overhead. Implementing this solution is entirely frictionless. Practices can complete onboarding, establish their specific clinical protocols, and go live within 48 to 72 hours, all without the restriction of long-term contracts. Medical practices have a clear path forward. By initiating a structural shift to an intelligent virtual workforce today, they have the immediate power to permanently cure portal burnout, slash administrative costs,